Hi Jamie, so you mentioned to me that you're studying occupational therapy, right? What is it about?
Well, occupational therapy is a client-centered occupation, meaning that we focus mainly on what the clients do in their daily lives and the occupations they participate in. Because it is client-centered, the clients are also involved in the planning of the therapy and the intervention process.
So what do you mean by occupations? Is it like a job?
Yes, but not entirely. In this case, occupation refers to any activity that holds meaning to an individual and something that they engage in. So, for example, what do you love doing in your leisure time?
I love playing water polo.
Okay, well, then water polo is an occupation to you because it's something that holds meaning to you and it's something that you engage in, right? There are many types of occupations such as leisure, which is water polo, and there are self-care routines and also productivity. These are all occupations. And occupation is a core therapeutic medium in occupational therapy, as everything that the occupational therapist does revolves around these occupations. And so much emphasis is placed on these occupations because it's something that gives meaning to every individual and it's something that motivates us to continue in life every day, and it builds an individual's character.
So what is the role of an occupational therapist then?
The role of an occupational therapist is to empower patients and help them overcome the barriers which they face when they have an impairment, and also help them regain their occupational performance in the activities that they used to do. In a typical occupational therapy session, what the occupational therapist would do is we'll get to know more about our clients and what they want to do and have to do in their lives. And it's followed by the assessment of their range of movements, what can they do, what can't they do, and also we'll look at the environment in which they live in and also the environment in which their occupations occur in. So for example, if you got into a car accident and you have to amputate your leg, what an occupational therapist would do is we'll help you get back into playing water polo because that's what you love, right? And we'll go to the environment in which you play water polo and we'll look and to see if there's any modification to the environment that can be done. Or we could also look at personal equipment that could help you get back into playing water polo, like a prosthetic leg, and we'll help you learn how to use the prosthetic leg to get back into swimming in the water. We can also help you modify your environment at home such that you are able to go about doing your self-care routines independently. So you're studying physiotherapy, right? Health professionals such as yours deal with the physical management and recovery of patients. However, for occupational therapists, we work around the impairments and help our clients in adapting to the impairments that they have. We really get into the lives of our patients. We talk to their family members and we help them in regaining their occupational performance. And we are the hope that tells our patients that it's not over when they have an injury or an impairment. Essentially, occupational therapy is an art and science. It's a science because we understand the physical condition of our clients, and it's an art because every client is unique. They have different goals in life and different occupations, and this is what occupational therapists value and focuses on.